Hello again, this is Dr. John Hoy, physician and surgeon of the foot and ankle, practicing in the heart of downtown Seattle, Washington. Welcome to my treatment room. Today, we will be talking about 7 reasons why you should see a podiatrist for your foot and ankle problem. Number 7. A podiatrist can prescribe antibiotics and perform surgery. When a person has a wound on their foot, for example, it is important to see a podiatrist. The problem is that most areas of the foot and ankle, unlike the abdomen or the arm, the skin is very close to the bone. For diabetics or people with poor circulation especially, it is very easy to get an infection that goes into the bone. A podiatrist is trained to treat wounds and delegate to a wound care center if needed. They also have an understanding of the biomechanics to determine proper weight-bearing status. Additionally, they can also treat infections with antibiotics or urgent or emergent surgeries if needed. Number 6. A podiatrist is a doctor. For shoes or inserts, it is important to consult someone with a medical degree. Orthotic therapy, like eyeglasses or braces, is a complicated science. Only a podiatrist has the depth of training to prescribe the proper treatment and device for your foot condition. Number 5. A podiatrist can administer medication and order tests. For a patient with an injury, it is important to see a podiatrist to establish a definitive diagnosis of which structure is injured and how badly. Improper movement or exercise when immobilization is needed can make the condition worse. A podiatrist understands the anatomy of the foot and leg and what is needed to heal the structure. They can order tests such as MRIs, CTs to establish a diagnosis, give medications as needed for pain, immobilize the structure, or perform surgery if needed. They may also direct a physical therapist if this treatment is needed. Number 4. A podiatrist is a specialist. A foot or ankle problem is best treated by an expert in the field, a podiatrist. They have the most education and training specific to the foot and ankle and undergo the most rigorous and comprehensive certification process of any specialist. They are also collaborative members of multidisciplinary patient care teams and innovators in treatment protocols and surgical procedures. It is important to ask to see a podiatrist sooner rather than later, especially if the condition persists. Number 3. A podiatrist exclusively treats feet. A podiatry referral is indicated to evaluate for treatment of all foot and ankle conditions, including fractures or surgery on the foot and ankle. Other types of specialists may perform surgery throughout the body on muscles, bones, and joints, shoulders, hips, knees, etc. Only a podiatric foot and ankle surgeon is specialized to exclusively perform foot or ankle surgery on the muscles, bones, joints, but also on skin structures, nerves, etc. Number 2. A podiatrist can treat urgent foot conditions. Oftentimes in the emergency department, a podiatrist is called for a foot and ankle problem. For urgent conditions involving the foot or ankle, especially during business hours when a podiatrist is available in their office, it may be more efficient to be seen by a specialist right away. Number 1. A podiatrist is your choice for foot and ankle medical and surgical care. People know best what they do the most of. An artist knows about art. A gymnast knows about gymnastics. An appliance salesperson knows about appliances. Podiatrists attend podiatric medical school and residency to be physicians and surgeons of the foot and ankle. Their practices are dedicated to this important part of the body to treat it in the best and most integrative way possible based on medical science. If you are a patient with a foot or ankle problem, call our office today for an appointment. As always, take care and have a great day.